And those are some of the headlines. This is Democracy Now!, democracynow.org, The War and Peace Report. We're on the road in Medford, Oregon. We're broadcasting from SOP TV, Southern Oregon Public Television. I'm Amy Goodman. Health care reform cleared its first hurdle in the Senate this weekend. In a party-line vote of 60 to 39, the Senate voted Saturday evening to open debate on the bill put forward by Senate Majority Leader Harry Reid. All 58 Democrats and both independents voted in favor of the motion, while 39 out of 40 Republicans voted against it. At a news conference immediately following the vote, Reid said, quote, "The road ahead is a long stretch, but we can see the finish line."
Don't try to silence a great debate over a great crisis. Don't let history show that when given the chance to debate and defend your position, to work with us for the good of our country and constituents, you ran and hid. You cannot wish away a great emergency by closing your eyes and pretending it doesn't exist. There is an emergency, and it exists now.
Well, for more on the Senate version of the health care bill, I'm joined from Washington, D.C. by Ryan Grim, the senior congressional correspondent for the Huffington Post. Ryan, welcome to Democracy Now! Talk about the significance of this bill.
You know, Amy, really, nobody should underestimate how significant this procedural vote on Saturday night was. People might want to portray it as, simply, a matter of moving to debate. But the fact that 60 Democrats, 60 members of the Democratic caucus could unite behind the leader and push this forward against all 40 of the Republican senators shows that Democrats are at least united in getting something done. Now, and it's a sizable something, whether or not the public option even ends up in the final bill. This is, one of the biggest social programs that has made it this far in the Senate in probably a generation. There are going to be tremendous amounts of subsidies that are going to go to low working and middle class Americans so that they can purchase private health insurance. Now, if there's no public health insurance option, that could also amount to just a giant giveaway to private insurers. But at least the giveaway would come with them turning around and giving people health insurance. Now, the big question that's going to face Harry Reid and the Senate Democrats over the next couple weeks is this public health insurance option. You have folks like Ben Nelson, Joe Lieberman, Blanche Lincoln, Mary Landrieu, who are uncomfortable with a public option. But then you have people on the left, Bernie Sanders, Sherrod Brown, even Roland Burris, saying that they're not going to support something unless it meets what they want. So Reid has to try to find where he can cobble together the 60 votes. But what's interesting is that they're no longer debating whether to have a public option, but it's now what form it will take. And it looks like something is shaping up around Tom Carper, he's a Democrat from Delaware, kind of a centrist conservative guy, who he was the guy that sort of originally proposed this public option that would allow individual states to opt out of it. I think he might have been a little bit surprised, actually, that it did so well and that it's become the central part of this debate. Now he's coming in with a new plan that instead of an opt-out, there would be an opt-in. But if states didn't opt in and insurance is unaffordable in those states, then they're automatically enrolled. So if somebody like Alabama says, we don't want to be part of this, but insurance is unaffordable in the state, then they're automatically enrolled in it. Now, I talked to Olympia Snowe on Saturday night, and she said that Carper has asked her for elements of her trigger language. So it looks like Snowe and Carper might try to meld something that could maybe get the support of people like Landrieu and Nelson, who aren't ideologues about the thing like Joe Lieberman is, and that could get you to 60.
Talk about what happened with the, Stupak amendment in the House, this whole battle over women's right to choose being included and covered by health insurance. What's happening in the Senate, Ryan Graham?
This was something that you could kind of see coming in the House because you have this block of apparently it's 64 Democrats now who are willing to vote for extreme restrictions on reproductive freedom. So they were able to accomplish the biggest rollback of reproductive rights in probably a generation, which, they passed this Stupak amendment, which would in many cases prevent women from spending their own money on private plans that cover abortion. Now, the Senate pushed back on this. Paradoxically, the Senate is actually more progressive on the issue of choice. There are a lot of different reasons for that. Partly it's because you have senators who represent entire states rather than just tiny kind of center-right or right-wing districts, and they just simply do not have 60 votes to push through the extreme rollback of reproductive rights. So what they did is they put into the Senate bill language that says no federal money will go to abortion, and that is intended to satisfy folks who say that they don't want their tax dollars to fund abortion procedures. So the folks who then say, well, money is fungible, and if I give you $1 here, you might spend $1 somewhere else. They said, well, okay, the Health and Human Services Secretary can audit these insurance plans to make sure that this dollar here is not going to fund this project over here. Now, of course, the irony here is that churches are the ones making this argument that money is fungible. At the same time, churches get get all kinds of tax breaks and government money. And then at the same time, they do government lobbying, and they say, well, we're not doing the government lobbying with these tax breaks, and we have separate entities. So clearly, they're of the opinion that you can separate funds. So that's all that the Senate does, and it is going to set up a fight on the House side. So Pelosi's going to have her work cut out for her to get it through. Now, it's unlikely, though, that these 64 Democratic House members are all going to hold together to block health care reform. A number of them have said that if it comes down to killing the bill, that they're not willing to take that step. These are still, believe it or not, Democrats. And if the Senate has passed this landmark, historic health care reform legislation, sent it over to the House, and the only thing standing between President Obama and this health care reform bill are these Democrats, enough of them, I think, are probably going to come on board for it and just swallow it and vote for the compromise.
Ryan Grimm, the position of Bernie Sanders, the independent of Vermont, the Democratic Socialist of Vermont.
He's been inching closer and closer to drawing a line in the sand over the last several months. And he makes a very clear and frankly, a convincing case. He says, look, this is a Democratic written bill. More than 80% of Democrats want a public option. More than 50 senators want a public option. So how are we going to let 2, 3, or 4 conservative Democrats dictate to the rest of the party whether or not there's going to be a public option in the bill? He has yet to make the final decision to filibuster a bill that does not include a public option. And if only one Democratic senator or member of the Democratic caucus, which he is, decides to filibuster it, then they don't have the votes unless they move to the right and can pick up a Snow or Collins or somebody like that. On Sunday, he said that he would not vote for final passage of a health care bill if it didn't include a public health insurance option. Now, that's slightly different than saying that he would filibuster it. So, in other words, he would vote to end a filibuster, but then when it comes up for final passage, he won't be there. But they only need 50 votes plus Joe Biden on final passage. But it's a step closer. And in his statement, he said that he strongly suspects that there are other members of the Democratic caucus that feel like he feel the same way that he does. And I said Sherrod Brown and Roland Burris are among them. So if you end up having a block of 4, 5, 6 Democrats who withhold their support, or 1 or 2 who say that they will filibuster a bill that doesn't have a public option, then Reid simply has to deal with them, or the bill can't get through, and that raises the pressure on people like Landrieu and Lieberman who want to kill it from the opposite side.
Ryan Grimm, I wanted to move to the amendment to audit the Federal Reserve that passed the House Finance Committee last week. The amendment was co-sponsored by Representatives Ron Paul and Alan Grayson. This is Florida Democrat Grayson speaking before the vote.
What kind of country are we going to have? Over the past few weeks and months, of the past 2 years, we've seen the Federal Reserve hand out $500 billion worth of money to foreign central banks, our money that cheapens the value of every dollar that's in our pocket, every dollar that's in our bank account, every dollar that's in our 401k. We've seen the Federal Reserve, among other things, remove $230 billion from Citibank's liabilities for mortgage-backed securities and accept that liability itself while leaving Citibank the entire upside in exchange for nothing.